Question number 1. A 1-month-old infant presents with repeated episodes of cyanosis and has been noted to have a heart murmur. On physical examination, there is a loud, continuous, machinery-like murmur heard best at the upper left sternal border. Which of the following is the most likely diagnosis? The options are atrial septal defect, ventricular septal defect, C. Patent ductal arteriosus, D. Tetralogy of Fallot. The answer is A. A continuous murmur, machinery-like murmur, is the classic presentation of a patent ductus arteriosus, which is an abnormal connection between the aorta and pulmonary artery. Next question. Question number 2. A 5-year-old boy is brought to clinic with fever, sore throat, and strawberry tongue. He has a fine sandpaper-like rash that started on his chest and is now spreading to his entire body. Which of the following is the most likely causative organism? Options are A. E. coli, B. H. influenza, C. Streptococcus pyogenes, D. Staph aureus. The answer is Streptococcus pyogenes. This bacterium is the cause of scarlet fever, which presents with classic triad of symptoms including fever, strawberry tongue, and a sandpaper-like rash. Next question. Question number 3. A 7-year-old child presents with 2-week history of painless gross hematuria. The child's mother reports a recent sore throat 1 week prior to onset of the hematuria. On examination, the child has mild periorbital edema and hypertension. Urine analysis reveals red blood cells casts. Which of the following is the most likely diagnosis? Options are A. IgA nephropathy, B. Minimal change disease, C. HUS, hemolytic uremic syndrome, D. Post-streptococcal glomerulonephritis. The answer is D. Post-streptococcal glomerulonephritis. This condition is a classic cause of acute nephritis in children, often following a strep throat infection and presenting with hematuria, edema, and hypertension. Next question. Question number 4. A 6-month-old infant presents with a history of intermittent severe abdominal pain, crying and drawing their legs up to the abdomen. The mother also reports that the child has passed current jelly stools. On physical examination, a sausage-shaped mass is palpable in the right upper quadrant. What is the most likely diagnosis? The options are A. Pyloric stenosis, B. Intussusception, C. Hirschsprung disease, D. Appendicitis. The answer is intussusception. This is a classic presentation of intussusception where a segment of the intestine telescopes into adjacent part, leading to intermittent pain and bloody current jelly stools. Next question. A 9-year-old girl has been diagnosed with type 1 diabetes mellitus. Which of the following is the most appropriate long-term management strategy? The options are A. Oral hypoglycemic drugs, B. Regular exercise without any medication, C. Dietary modification alone, D. Insulin therapy. The answer is D. Insulin therapy. Type 1 diabetes mellitus is an autoimmune condition resulting in the destruction of pancreatic beta cells, necessitating lifelong exogenous insulin therapy for survival. Next question. Question number 6. A 3-year-old child presents with high fever, muffled voice, drooling, and respiratory distress. The child is sitting in a tripod position. On examination, there is no stridor at rest. Which of the following is the most likely diagnosis? The options are A. Epiglottitis, B. Croup, C. Bronchiolitis, D. Foreign body aspiration. The answer is epiglottitis. This is a classic presentation of epiglottitis, a life-threatening emergency characterized by high fever, tripod position, drooling, and muffled voice due to airway obstruction. Next question. A 1-year-old infant is brought to the emergency department with a history of coughing, wheezing, and rapid breathing for 2 days. The child has a low-grade fever and runny nose. On auscultation, there is fine crackles and expiratory wheezing. The chest X-ray shows hyperinflation. What is the most likely diagnosis? The options are A. Bronchiolitis, B. Croup, C. Asthma, D. Pneumonia. The answer is A. Bronchiolitis. Bronchiolitis is a common viral infection of the small airway in infants, presenting with cough, wheezing, and signs of respiratory distress like tachypnea and chest hyperinflation. Next question. A 6-year-old child is diagnosed with acute lymphoblastic leukemia. Which of the following is a common presenting symptom? The options are A. Bone pain and fever, B. Chronic cough and wheezing, C. Sudden onset of severe abdominal pain, D. Painless lymphadenopathy and splenomegaly. The answer is A. Bone pain and fever. Bone pain and fever are very common symptoms in children with ALL due to the proliferation of leukemic cells in the bone marrow, leading to marrow expansion and pain. Next question. A 2-year-old presents with 3-day history of high fever and refusal to eat. The fever has now resolved and the child has a diffuse maculopapular rash on the trunk and neck. The mother repeats that the child had no rash while fever was present. What is the most likely diagnosis? The options are A. Measles, B. Roseola infantum, C. Varicella, D. Rubella. The answer is Roseola infantum. Roseola infantum is a classic childhood illness where a high fever abruptly resolves, followed by appearance of maculopapular rash on the trunk and the neck. Next question, question number 10. A newborn is noted to have jaundice on the second day of life. The total serum bilirubin is 12 mg per deciliter. The baby is exclusively breastfed and is otherwise healthy. The baby's blood group is A positive and mother's blood group is O positive. What is the most likely cause of the jaundice? Options are A. ABO incompatibility, B. Biliary atresia, C. Physiological jaundice, D. Breast milk jaundice. The answer is C. Physiological jaundice. This is a common benign condition in newborns that peaks at 3 to 5 days of life, and the bilirubin level is within a range consistent with a healthy breastfed infant. Next question. Question number 11. A 10-year-old boy presents with sudden onset of severe right testicular pain and swelling. On examination, the testicle is tender, swollen, and lies in a transverse position. The cremasteric reflex is absent. What is the most likely diagnosis? The options are A. Epididymis, B. Hydrocele, C. Architis, D. Testicular torsion. The answer is testicular torsion. Testicular torsion is a surgical emergency characterized by sudden severe pain, an elevated or transverse lying testicle, and a negative cremasteric reflex. Next question. Question number 12. A 4-year-old child presents with a high fever, conjunctivitis, cervical lymphadenopathy, and polymorphous rash. The child also has cracked red lips and a strawberry tongue. The parents deny any history of sore throat. What is the most likely diagnosis? The options are A. Hand, foot, and mouth disease, B. Measles, C. Scarlet fever, D. Kawasaki disease. The answer is D. Kawasaki disease. Kawasaki disease is a vasculocytes that classically presents with prolonged fever and at least 4 of the following: conjunctivitis, rash, lymphadenopathy, and changes in the oral mucosa, such as strawberry tongue and cracked lips. Next question. Question number 13. A 8-year-old girl is diagnosed with attention deficit hyperactivity disorder, ADHD. Which of the following is the most appropriate first line treatment? The options are A. Atomoxetine, B. Methylphenidate, C. Risperidone, D. Cognitive behavior therapy. The answer is methylphenidate. Stimulants like methylphenidate are considered the most effective and first-line pharmacological treatment for ADHD in children aged 6 and older. Next question. Question number 14. A 6-year-old boy presents with a 2-day history of painless lump in his neck. On examination, a single firm, non-tender, rubbery lymph node measuring 2 cm is palpable in the supraclavicular region. There are no other constitutional symptoms. What is the most likely diagnosis? The options are A. Tuberculous lymphadenitis, B. Reactive lymphadenopathy, C. Hodgkin lymphoma, D. Non-Hodgkin lymphoma. The answer is Hodgkin lymphoma. Painless, rubbery, and firm lymphadenopathy, particularly in the supraclavicular region, is a classic presentation of Hodgkin lymphoma in children. Next question. Question number 15. A 3-year-old boy presents with a history of fever, irritability, and a bulging non-pulsatile anterior fontanelle. He is also refusing to feed. A lumbar puncture is performed and reveals high protein, low glucose, and high cell count with predominance of neutrophils. What is the most likely diagnosis? The options are A. Viral meningitis, B. TB meningitis, C. Bacterial meningitis, D. Encephalitis. The answer is C. Bacterial meningitis. The findings of the high protein, low glucose, and a predominance of neutrophils in the cerebrospinal fluid are classic for bacterial meningitis. Next question. Question number 16. A 7-year-old girl with a history of recurrent respiratory infections, steatorrhea, and poor weight gain is brought to the clinic. On examination, she has a chronic cough and a low body mass index. A sweat chloride test is performed and shows an elevated chloride concentration of 80 milliequivalent per liter. What is the most likely diagnosis? The options are A. Chronic bronchitis, B. Celiac disease, C. Cystic fibrosis, D. Asthma. The answer is C. Cystic fibrosis. Cystic fibrosis is a genetic disorder affecting exocrine glands, which classically presents with a combination of recurrent respiratory infections and pancreatic insufficiency, leading to steatorrhea and overgrowth. A sweat chloride test over 60 milliequivalent is diagnostic. Next question. Question number 17. A 1-month-old infant presents with non-bilious projectile vomiting after every feed. The infant is ravenously hungry and has a hungry look but is failing to gain weight on physical examination, a palpable olive is felt in the right upper quadrant of the abdomen. What is the most likely diagnosis? The options are A. Intestinal malrotation, B. Pyloric stenosis, C. Gastroesophageal reflux disorder (GERD), D. Duodenal atresia. The answer is pyloric stenosis. This is a classic presentation of pyloric stenosis, where hypertrophy of the pyloric muscle causes a functional obstruction leading to projectile vomiting and a palpable olive mass. Next question, question number 18. A 2-year-old boy presents with a limp and pain in his right hip and knee. He has a low-grade fever and appears well. On examination, he holds his hip in a position of flexion, abduction, and external rotation. Plain radiographs of the hip are normal. What is the most likely diagnosis? The options are A. Leg club Parthas disease, C. B. Septic arthritis, C. Slipped capital femoral epiphysis, SCFP, D. Transient synovitis. The answer is transient synovitis. Transient synovitis is a self-limiting inflammation of the hip joint that is the most common cause of the hip pain and limp in children, often followed by viral illness, and is characterized by favorable outcome. Next question, question number 19. A 9-year-old child presents with a sudden onset of facial weakness with an inability to wrinkle the forehead on the affected side. The child reports a recent viral illness. Examination reveals paralysis of the muscles of facial expression on one side of the face, but sensation is intact. What is the most likely diagnosis? The options are A. GVS Guillain-Barré syndrome, B. Bell's palsy, C. Stroke, D. Myasthenia gravis. The answer is B. Bell's palsy. Bell's palsy is an idiopathic unilateral facial nerve paralysis that affects all branches of the facial nerve, causing weakness of the forehead and the lower face, and is often associated with a preceding viral illness. The next question. Question number 20. A 4-year-old child is brought to the emergency department after ingesting a large number of children's vitamins. The child is initially asymptomatic but begins to vomit and have abdominal pain a few hours later. A radiograph of the abdomen shows several radio-opaque tablets. Which of the following is the most likely substance ingested? Options are A. Lead, B. Acetaminophen, C. Iron, D. Aspirin. The answer is iron. Iron toxicity is typically present with an asymptomatic period followed by gastrointestinal symptoms such as vomiting and abdominal pain. Iron tablets are also radiopaque and will be visible on X-ray. Next question. Question number 21. A 3-year-old child with a history of fever, irritability, and a bulging non-pulsatile anterior fontanelle presents with high fever. A lumbar puncture is performed and reveals high protein, low glucose, and high cell count with a predominance of neutrophils. Which of the following is the most appropriate initial management? Options are A. Oral antibiotics, B. Observation and supportive care, C. Antipyretics and analgesics only, D. IV antibiotics. The answer is D. IV antibiotics. IV antibiotics should be started immediately without delay in any child with suspected bacterial meningitis to prevent severe neurological sequelae and death. Next question. Question number 22. A 1-month-old infant is brought to the clinic for a routine checkup. The mother mentions that she is concerned about a small, soft, reducible swelling at the baby's navel that seems to get bigger when baby cries. On examination, the swelling is noted to be an umbilical hernia. What is the most appropriate management for this condition? The options are A. Observation and reassurance, B. Prescribe medication to strengthen the abdominal wall, C. Apply a tight abdominal band or coin over the hernia, D. Surgical repair immediately. The answer is observation and reassurance. Most umbilical hernias in infants spontaneously close by 1 to 2 years of age. So observation and reassurance are most appropriate initial management. Next question. Question number 23. A 10-month-old infant presents with a history of coughing, wheezing, and rapid breathing. On examination, the infant is tachypneic with intercostal and subcostal retractions. There is also widespread expiratory wheezing. The child is afebrile. A nasal swab is positive for respiratory syncytial virus (RSV). What is the most likely diagnosis? The options are A. Croup, B. Pneumonia, C. Bronchiolitis, D. Asthma. The answer is C. Bronchiolitis. RSV is the most common cause of bronchiolitis, a viral infection of the small airways in infants that leads to inflammation and obstruction, causing wheezing and respiratory distress. Next question. Question number 24. A 5-year-old child presents with a 2-day history of low-grade fever, sore throat, and headache. On examination, the child has several vesicles and ulcers on the soft palate, tonsils, and uvula. There are no lesions on the hands or feet. What is the most likely diagnosis? The options are A. Herpangina, B. Measles, C. Hand, foot, and mouth disease, D. Streptococcal pharyngitis. The answer is A. Herpangina. Herpangina is a viral illness caused by Coxsackie virus, which presents with a fever and painful ulcers on posterior oropharynx, soft palate, and tonsil. Next question. Question number 25. A 6-year-old girl is brought to the clinic with a history of a recurrent urinary tract infection (UTI) and bedwetting. A widening Cystourethrogram VCUG is performed and shows reflux of urine from the bladder to the ureter during voiding. What is the most likely diagnosis? The options are A. Bladder dysfunction, B. Nephrolithiasis, C. Vesicoureteral reflex, D. Urethral stricture. The answer is C. Vesicoureteral reflex. The vesicoureteral reflex is the retrograde flow of urine from the bladder into ureters and kidneys, which is a common cause of recurrent UTIs and pyelonephritis in children. Next question. Question number 26. A 12-year-old boy presents with gradual onset of limb and knee pain. He is overweight. On examination, there is limited internal rotation and abduction of the hip. The knee pain is worse with activity. A radiograph of the hip reversal, a posterior and inferior displacement of the femoral head from the neck. What is the most likely diagnosis? The options are A. Transient synovitis, B. Slipped capital femoral epiphysis, SCFE, C. Leg Karl-Barthes disease, D. Osgood-Schlatter disease. The answer is SCFE. This condition is a displacement of the femoral head that most common is obese adolescents and presents with a limp and pain that may be referred to the knee. Next question. Question number 27. A 2-month-old infant presents with vomiting and poor feeding. Physical examination reveals a failure to thrive and a heart murmur. Blood tests show metabolic acidosis with an elevated serum lactate. Urine testing reveals a mousy or musty odor. What is the most likely diagnosis? The options are A. Phenylketonuria, B. Maple syrup urine disease, C. Tyrosinemia, D. galactosemia. The answer is A. Phenylketonuria. PKU is an inborn error of metabolism that is untreated can lead to intellectual disability and a characteristic mousy or musty odor in the urine sweat due to accumulation of phenylalanine metabolites. Next question. A 4-year-old child presents with a high fever, headache and neck stiffness. A lumbar puncture is performed and shows an opening pressure of 250 mm of water, a cell count of 500 cells per microliter with 90% neutrophils, a glucose level of 30 mg per deciliter, and a protein level of 150 mg per deciliter. What is the most likely diagnosis? The options are A. Fungal meningitis, B. Bacterial meningitis, C. Viral meningitis, D. Tubercular meningitis. The answer is bacterial meningitis. A combination of high opening pressure, high cell count with neutrophil predominance, low glucose, and high protein is a classic presentation of bacterial meningitis. Next question. Question number 29. A 6-year-old boy presents with limp pain in his right hip and a low-grade fever. On examination, he holds his hip in a position of flexion and external rotation. A plain radiograph of the hip is normal. The child has had a recent upper respiratory tract infection. What is the most likely diagnosis? The options are A. SCFE, B. Septic arthritis, C. Juvenile idiopathic arthritis, D. Transient synovitis. Answer is D. Transient synovitis. Transient synovitis is the most common cause of hip pain and limp in children, often following a viral illness, and is diagnosis of exclusion in otherwise healthy child with normal radiographs. Next question. Question number 30. A 1-year-old child presents with a 2-day history of fever, irritability, a bulging anterior fontanelle. The child has no history of immunization. A lumbar puncture is performed and reveals high cell count with predominance of neutrophils. What is the most likely causative organism? Options are A. HIV H influenza type B. Option B. E. coli, C. Streptococcus pneumoniae, D. Neisseria meningitidis. The answer is A. HIV. This bacterium was a common cause of bacterial meningitis in unimmunized children and adolescents before widespread use of HIV vaccine. Thank you. Please like, share and subscribe.